Shall we start? On Monday and Tuesday, we are going to have early clinical exposure related to this topic only. Okay? Homeostasis, temperature regulation, fever. Okay? If you have gone through the timetable. So in previous class, we have seen something related to core and shell temperature, body temperature. The core temperature has to be maintained at a particular rate or the set value. And what are the different mechanisms by which that value can be maintained? What is the value of core temperature? In the previous class, we have completed till what were the different mechanisms by which we were seeing the production of heat. The term used was thermogenesis. If you are not interested in class, okay, you can leave the class right now. But if you have entered at your own risk, so please be seated silently. Okay. So today's objective, what will be objective? We will see what are the different mechanisms by which the body tries to lose heat. What are the different variations seen when the temperature, the ambient temperature, the external environmental temperature increases or decreases. So what are the balance maintained by the body, and what is the main center which is responsible for balancing the temperature of the body? When we are talking of temperature of the body, we are talking specifically of the core body temperature. Okay, shell means the skin temperature, but what we are mainly concerned is the temperature of the core. Okay, so whenever body temperature, it is the core body temperature. In case of heat loss mechanism, okay, there are two requirements which will be responsible for the heat loss mechanism. Okay, first, the heat which is generated in the body, okay, and that heat is generated and it is brought about to the shell area or to near to the skin area, and from the skin it has to be dissipated or lost. So two main mechanisms: from the core or the internal body environment, it has to be maintained, it has to be carried to the surface, and from there how it is dissipated by different mechanisms. This includes heat loss from skin, heat loss from lungs, and heat loss. Heat loss in excreta is in minor quantity, mainly or roughly about 2 to 3%. From lungs also it is in very minor quantity. This heat loss through lungs, okay, is in less quantity, but heat loss through exhalation, okay, is mainly seen in lower animals. Another short note question you might get, okay, this has a special thermoregulatory mechanism seen especially in the lower animals. In case of dogs, you can see the continuous exhalation or outward movement of the tongue. So continuous a process takes place by which there is evaporation of the fluid through the tongue, okay, and that is known as panting, P-A-N-T-I-N-G. You get a short note on this, a very rare question asked, but still you might get a short note. तो तुमको जो तुम खुद बोल रहे हो क्या हो गया? If you have any extra information or knowledge, just raise your hand. We'll be happy to share that information or knowledge. Yeah? क्योंकि वो knowledge अभी 25-26 को पता चल जाएगी. Okay? So, in case of human beings, the most important source for heat loss mechanism is through skin. Now, what are the different mechanisms by which the body can lose heat? Is radiation, conduction, convection, and evaporation. Now, another important MCQ comes, which is best method by which the body can lose heat. Yes? Anybody? Radiation, conduction, convection, evaporation. For evaporation, how many of you are favor in evaporation? Only for 3. So the best answer is 60% of the body loses heat through radiation. 25 to 30% of the body lose heat through evaporation. Okay. Now this 60% heat loss through radiation depends on the external temperature or the ambient temperature. That the surrounding temperature is less or the surrounding temperature is more. But the most common method for heat loss mechanism is radiation, conduction, convection and evaporation. Okay, depending on the external environment, if the body is warm and the external environment is cold, then the body is going to lose heat in the form of infrared radiation. If the external temperature is hot, the body is going to gain heat. Okay, if a person is sitting under a tin shade or asbestos sheet, the asbestos sheet during summer is having more of heat, so the body will take heat from that object. In case of winter, it will be opposite, that the body is going to dissipate heat. So depending on the environmental condition, radiation is the best source for heat loss. 60% is getting lost through radiation. For convection to take place, the air movement has to be there. Okay, for conduction, the surface contact has to be there. So major source of heat loss mechanism is radiation and evaporation. Depending on the environmental condition, previous class I have told you, if a person is residing in the coastal area, the humidity of the environment, okay, that will resist the evaporation mechanism. So that will be a big problem for heat loss mechanism. Clear? So heat gain mechanism and heat loss mechanism. These mechanism has to be in balance. Okay, these are the mechanism by which heat loss takes place. Radiation, conduction and convection, the air movement has to be there, and for evaporation there is continuous diffusion of sweat. Okay, the person feels or does not have the sensation, but 24/7 some amount of sweat is lost. That is known as insensible perspiration. That is known as insensible perspiration. The sweat mechanism or the sweat taking place through the sweat ducts, okay, that is known as EXCRETA, and the sweat mechanism taking place through the hair follicle mainly after the age of adolescence takes place through the apocrine glands. There is difference in the constituent of the sweat. Okay, the apocrine gland secretion, they have a very pungent smell. Okay, they are responsible for having pheromones. Okay, now what are the factors which affect the cutaneous heat loss? Okay, when we are studying or when we know the structure skin, beneath the skin we have the arteriovenous anastomosis, venous plexus, continuous circulation is coming. Okay, now the small range of temperature with the hypothalamus is set, and if there is variation, okay, the hypothalamus will set the temperature automatically and that has to be reset. तो ये जो सेट मैकेनिज्म है, इसको किस किस तरीके से कर सकते हैं अपन, इसी का आज ऑब्जेक्टिव है. लास्ट क्लास मंडे को है, इन दैट विल कवर दी अप्लाइड एस्पेक्ट. ओके, हाउ द रेडिएटर सिस्टम इज फॉर्म. फॉर हीट लॉस मैकेनिज्म, टू प्राइमरी थिंग. वन, द कोर heat has to come to the skin. From the skin, it has to be dissipated. So for radiation system, radiator system is formed by cutaneous circulation, venous plexus under the skin, which is supplied by inflow of blood from the skin capillaries. In exposed areas like hands, feet and earlobes, there is arteriovenous anastomosis. They are dilated, blood flow increases to the venous plexus, and through radiation, the heat is lost. The most common type of heat loss mechanism. Okay, blood vessels constrict and blood flow to the plexus decreases. क्या होता है cold temperature में? Vasoconstriction. Okay, so decreases, skin temperature becomes less than core and heat loss is minimized. This happens in the cold environment. Okay, this is vasodilation and vasoconstriction. Vasodilation, when the external temperature is more and the body has to lose heat, the core temperature has to be maintained. When the environment temperature is less and the body has to conserve heat, there is vasoconstriction. The first step involves in temperature regulation. Okay, the insulator system. What are the different insulator systems present in human body? The most unstable thermoregulatory mechanism is seen in newborn, infants and old age. What happens in newborns and infants? They have a layer of brown. So what mechanism takes place under the brown fat is uncoupled phosphorylation reaction. There is no new net formation of ATP, but the heat is getting formed. Okay, lost. So subcutaneous act as insulator. The insulation is important in maintaining the core temperature. इसके अंदर थर्मोजेन का रोल आता है, अनकपलिंग रिएक्शंस होती हैं, थायरॉक्सिन का भी रोल होता है, ठीक है, ब्राउन फैट के अंदर. ये केवल किस में प्रेजेंट है? Majority is present in newborn and infant. In case of adults, it is present, but it is not the main source for heat loss mechanism in adults. Piloerector muscles, okay, horripilation or goosebumps. Clothing, woolen coats in humans and fur reduces the heat loss through body. Heat loss from lungs takes place by evaporation of water in the expired air. The example is seen in lower animals, especially in dogs, and the process is known as panting. Panting. Panting, panting, and an MCQ gets formed panting के ऊपर. ठीक है, इसको किस साइंटिस्ट ने, किस फिजियोलॉजिस्ट ने डिस्कवर किया था? That is a question we'll talk on Monday regarding this. Okay. So panting or rapid breathing in animals leads to heat loss by greatly increasing the amount of water to be evaporated in mouth and respiratory passage. About 1% of heat loss takes place through urine and feces, that is the excreta. Okay, this is a simple diagrammatic approach in which we can see evaporation through respiratory, that is panting, thermal radiation, evaporation, skin blood flow, how the core temperature is maintained, how the work induces the production of heat. Regulation of body temperature maintains the core temperature within plus or minus 1 degree Fahrenheit of the normal temperature. इसकी रेंज कितनी कम है, उसके अंदर प्लस माइनस 1 को है उसको मेंटेन करने का. ओके, नॉर्मल बॉडी टेम्परेचर इज सेट पॉइंट एट 98.6 और 37 डिग्री इन ह्यूमन अंडर फिजियोलॉजिकल कंडीशंस. प्लीज स्पेसिफाई और प्लीज बी focused on the term physiological conditions. Temperature regulations follow negative feedback mechanism. So if you get a question regarding homeostasis, this is the best example to be quoted of temperature regulation. Okay. How is it the example of negative feedback mechanism? अरे है या नहीं एग्जाम्पल है? So he is going to explain. सब में से चारों पांच में से कोई एक जना एग्जाम सबको दे रहा है प्लीज. This is the best example of negative feedback mechanism. Can you read this point? अरे अपना फर्स्ट चैप्टर है होम्योस्टेसिस. This means when the core temperature is increasing or when the core temperature is decreasing, there is automatic correction and the balance has to be maintained to maintain that temperature. If there is increase in the core temperature, it is not a vicious cycle that the body will try to increase the temperature. That will be a positive feedback. Okay, this is a negative feedback mechanism. If there is change in the temperature, the change may be increase or decrease. So if there is increase in the core body temperature, the hypothalamus will correct it automatically by a different mechanism which are present in the body itself. Can be there, and these two adverse conditions are corrected with the help of thermoregulatory mechanism. For their correction, they have a pathway or particular requirements that has to be seen or kept in mind. So this is the best example of negative feedback mechanism. ठीक है, एग्जाम में नहीं आ रहा है मतलब ये चीज आनी नहीं चाहिए. What do you mean by thermoneutral zone? Another example. Thermoneutral zone. It is there on the slide. You can read and just explain. You are comfortable without AC in which particular ambient temperature? Right now the external environmental temperature is 38 or are you comfortable? Yes or no? No. So what is the ambient temperature at which a person feels comfortable and the basal metabolic rate is at basal level or the minimum level? So thermoneutral zone refers to the range of ambient temperature within which the metabolic rate is at minimum. It need not to do extra effort. It is at the basal level. Okay. The body has to spend no energy beyond the basal metabolism for thermoregulation. Values for thermoneutral zone in human in different age group is adult 20. In case of newborn 32 to 34 and premature it is 35. Okay. So short note में ये भी आ सकता है T and Z. Okay. Some examiners they misinterpret that the students are very intelligent and they'll read the abbreviated forms. Okay. So they may give write a note on T and Z, that is thermoneutral zone. Or you might get a MCQ, thermoneutral zone of an adult person. The value are this. Clear? So you have two small questions in this particular slide. What do you mean by critical temperature? It is the lower limit of thermoneutral zone. Below it, the metabolic heat production of a resting animal increases to maintain the thermal balance. Temperature control system. It comprises the hypothalamus, integrated autonomic skeletal-motor response. What do you mean by this? Autonomic endocrine skeletal-motor response. Component of this system are thermoreceptors and hypothalamus and effector mechanism. Okay, in case of this, so we have the thermosensors or thermoreceptors. These thermosensors or thermoreceptors, they are present both in the deep or the core part of the body, as well as they are present in the skin or the cutaneous thermoreceptors. 90% of the thermoreceptors which are present on the skin, they are of cold thermoreceptors. They are sensitive towards the cold environment. So they will carry the stimulus or information regarding the cold environment or cold temperature. Okay, 90% or more than 90% of the heat sensitive receptors, they are present in the hypothalamus itself, the anterior hypothalamus and the preoptic area of the hypothalamus. So the sensitized in the core temperature. Okay, so the heat, if the body is generating more of the heat through circulation, it will reach to the hypothalamus, and there the heat sensitive thermoreceptors or thermosensors are located or present in the anterior hypothalamus preoptic area. In case of cold sensitivity, the 90% of the receptors, where they are located in the skin or the cutaneous. 10% they are present in the hypothalamus, but mainly the posterior hypothalamus is responsible for it. So the hypothalamus has a set point divided into anterior and posterior, and the thermosensors where they are located. So the first thing required for any homeostatic or feedback mechanism, information has to be carried. Information has to be received. So what are the things which substance which are receiving the information? They are known as receptors. Okay, the first step of reflex is receptors which are receiving the information. So in case of temperature regulation, mainly we are concerned with increase or decrease. So the ambient temperature is increased or decreased, they depend, and they will be sensitized or getting information through these receptors. Okay, they are integrated by autonomic, endocrine and skeletal-motor response. Receptors, function of receptor is to carry the information. The information will be read the hypothalamus or the temperature regulating center, that will give command or effect. Okay, and this effect is brought about by endocrine, autonomic and skeletal-motor response. Okay, now what do you mean by endocrine response? The response brought about by hormones. The most important hormones for metabolism required is thyroid. Okay, so there will be release of thyroxine that will change the basal metabolic rate. How is autonomic system involved? How is autonomic system involved? The sweat glands, they are innervated by which type of fibers? That is the exception. MCQ is asked. The sweat glands, they are innervated by the cholinergic nerve fibers. That is the exception, and that will result, and that is controlled by autonomic. The response is generated by autonomic nervous system. Okay, they are responsible for the secretion of epinephrine, norepinephrine, cholinergic nerve fibers, acetylcholine. So another response brought about by the autonomic nervous system. Third was skeletal-motor. How this response is brought about? If the body has to generate heat, what the mechanism brought about is for thermogenesis, shivering and non-shivering mechanism. In case of shivering, it is the involvement of the skeletal muscles. In case of non-shivering thermogenesis, it is the utilization of brown fat in case of infants or newborn babies. Okay, so one of the thermogenesis mechanism takes place with the help of skeletal motor response. Okay, so in a single line, the different responses can be seen. Okay, when you are writing an answer, okay, so that has to be explained depending on the number of marks. These are just PPT, so we can just give you a concept that you have to be elaborated. Okay, so there are two types of receptors: peripheral thermoreceptors, they are present on the skin and mucous membrane. Cutaneous senses the ambient temperature. Okay? 90% are receptors. Deep receptors present in the viscera sense the core temperature. They also mainly detect cold. Central, they are mainly present in the hypothalamus, probably neurons whose firing rate is higher, dependent on the local temperature. Local temperature of what? Local temperature of blood, the circulating blood. When the circulating blood reaches to the hypothalamus, they sensitize it. If the temperature of the blood increases, which is reaching to the hypothalamus, that will be read. If the temperature is less, that too will be detected. Okay. Better established are the preoptic areas and the anterior region of hypothalamus, also detected in midbrain, stem, and even spinal cord. Okay. Thermoregulatory effector response happens during cold and what happens during hot. Okay. So anybody can read. Mechanism conserving heat is vasoconstriction, piloerection. Mechanism increasing heat production is shivering, increased activity and behavioral response. What are the behavioral response? Behavioral responses: change in your eating habits, having more of the woolen clothes, okay, taking more of the hot soups or hot drinks, okay, these are the behavioral changes. Increase in the THS secretion, increases in catecholamines, okay. Now, we are talking dry environment right now, clear? What happens if the body gets immersed in cold or hot water? What will be the different mechanism by which the body can preserve heat or can lose heat? If the person gets immersed in water, okay, does evaporation can take place? No. Radiation? No. So which is the most common way of losing heat? Convection. Okay. So you have to keep different scenarios. Okay. What happens during cold environment is there will be vasoconstriction. When there is vasoconstriction for longer duration, okay, there will be definitely hypoxia. There will be oxygen requirement is there, so that will hypoxia will result in secretion and resulting into vasodilatation. So initially vasoconstriction, later on vasodilation. So what duration the body takes to acclimatize hot temperature or cold temperature? In case of hot temperature, the body takes 7 to 14 days to get acclimatized with that particular temperature. In case of winters, it takes a bit longer duration, maybe 2 to 3 weeks to get acclimatized. Okay, its applied aspect we'll see on Monday. What is frostbite? How does heat stroke take place? what is the lethal temperature, what happens to it. इसका clinical application बहुत important है. Clear? Mechanism activated by heat. What happens in summers? Okay. Observe सबने किया है, उसको describe आप कैसे करेंगे? Everybody deciding in that condition. सब राजस्थान में है या आसपास से ही है? सब है, सब एक्लिमेटाइज हो चुके हैं. ओके, so you have to, your body will take more time to acclimatize in hilly environment or snowy area. Okay, which temperature is more lethal for infants, hypothermia or hypothermia? Hypo, क्या हुआ? किसने जोक क्रैक किया? तो अपने आप हंस रहे हो? This is getting recorded, okay? Okay. Produced by the local effect of bradykinins from the sweat glands, spinal reflex evoked by the peripheral thermoreceptor, hypothalamic. Sweating causes marked loss of body heat and sodium chloride. So, if a person is coming from a hilly station, okay, to a desert area, what will happen? There will be initially a tremendous loss of sweat. Okay, the body cannot afford to lose that much of sodium and chloride. The profound loss of sweat mainly comprises of sodium and chloride. Cannot afford to lose sodium and chloride both. So what will happen in acclimatization, that the sweat secretion will increase, but there will be diminished secretion of sodium and chloride. So only watery content will increase. This is brought about with the additional secretion of aldosterone. So that will be a part of acclimatization. Clear? So what will happen if there is an imbalance of sodium chloride? Do electrolytes have some role? Okay, just go through these topics. I will see in your second semester exam. Okay, there are three types of water loss from the skin: insensible perspiration, thermal sweating, and eccrine sweat glands. Okay, insensible perspiration, the person is aware or not aware, 24/7 this kind of loss is seen or taking place in human being. That is insensible perspiration. Okay, second, sweating over palms and toes during emotional stress. This is called cold sweat, which you will see during your exam. Okay. Third is sweating all over the body when environmental temperature is hot. That is known as thermal sweating. Okay. Sweat wets the surface of the body and evaporates. The sweat does not have to be wiped out. It has to be evaporated. Please keep this in your mind. It has to be evaporated. If it is not evaporated, the body will not lose heat. So what happens in the humid condition? Evaporation is less, so one feels very uncomfortable instead of profuse sweating. Okay. This is the mechanism activated by cold. कितना टाइम हो गया? 40 है अभी तो बहुत टाइम है. Okay, vasoconstriction, shivering, non-shivering thermogenesis. This I have already told you. Role of brown fat. Okay, minimum in case of adults and maximum in case of newborns and infants. Thermogenesis is increased by 100% in infants in cold environmental conditions. Okay, this will cover in next class.